the entire urinary tract, and we opened the bladder. Look what's here. What is that?
Sphincter.
Well, there's sphincters in there. How about this whole thing is the bladder. Do you see what's back here? The white things? Were you listening today at all? No? Those are the seminal vesicles.
Seminal vesicles.
Is this a male or female?
Male.
So you can look at the bladder. It has the trigon. It has the openings in here. The urethral opening, and then the two openings to the ureters as well. And the vessels, I put down on the list all of the vessels basically that you can see on here you're responsible for. The adrenal gland, okay. Do you remember what was on the plaque? Go over it again.
Yes.
This is my favorite. All right. Beautiful. Yeah. So what's this whole structure called? What's this?
The pyramid.
Right, it's the pyramid. So this one, you can see the juxtamedullary versus the cortical nephrons, right? If, like when it's closed like this, you can only see the capsule, right? And then they open it up so that you can see the glomerulus, and you can see the afferent and efferent arterioles in most of them. You can see this blood supply right here. Do you remember what that's called? The loop, it services the loops basically. So, do you remember vasa vasorum?
Yeah. Wow.
Vasa recta.
Yes, vasa recta. Straight vessel.
See that.
Okay, so this part of the kidney, really, this part of the kidney, what is that called?
The cortex.
Yep, and so that means this is what? Medulla. Okay. What else you can see in this? It actually has numbers on it, but we're not going to do that. It's got the distal and proximal convoluted tubules are on here. It's got the descending and ascending limbs of the renal loop. What's this called? That long one right here? Collecting duct, right? So that's, you can see all these truncated pieces right here. Those are other nephrons that went into it. And when they collect and they gather together, when the collecting ducts gather with other collecting ducts,
There it is.
what do they become?
Common.
No, it's a good guess, but no. Papillary duct.
Okay. Papillary.
What area of the pyramid is this?
The apex.
Also a good guess, but no. Papilla, right, the papilla.
Papilla.
And then over here, we have the capsule and the glomerulus, and it's also showing both the endothelial layers. Is this one parietal or visceral? Visceral and parietal. Going into the tubule, right? And that's about it. It's got the afferent and efferent arterioles as well. It also has this structure that you'll learn about in physiology. This is a regulation mechanism. It's really cool. This is the distal convoluted tubule, part of it.
Distal convoluted.
And it's got in it like a flow meter. We have receptors in here that can perceive how quickly the filtrate is moving through the tubule. And if it is moving too fast, we need to slow it down. So you contract some of the vessels to decrease the pressure in here, which will slow down the filtrate going in and slow down the filtrate going through. If it's going through too slowly, then we dilate the vessels so that more can go through. In order to correctly remove what we need to remove from the filtrate and then put back in, reabsorb back into the blood what we need to, it has to go at a specific range. So that's a control mechanism. Anything else? Okay.